Hi, my name is Ashley Kiley. I'm a student of physical therapy at the University of Central Florida. Today I will be demonstrating some range of motion, manual muscle testing, and muscle length techniques of the wrist. So first, I will demonstrate passive range of motion for the wrist flexors. You want your goniometer axis on the ulnar styloid. You want the stationary arm parallel to the shaft of the ulna, and the movable arm parallel to the fifth metacarpal. You want your patient sitting across from you, elbow slightly flexed, arm on the table fully pronated with a towel underneath, just for comfort. A neutral wrist, hand over the table with relaxed fingers. So I'm going to place my goniometer in the correct position. I'm going to stabilize at the distal forearm and push the hand into flexion, so wrist flexion, until I feel an end feel. This end feel is firm, which is normal, and I see that my patient here has approximately 82 degrees of flexion. This is normal. The normal value is 80, so she's right in range, and the normal end feel should be firm. So next I'll be demonstrating passive range of motion for extension of the wrist. Again, same patients and therapist position across from each other, and the goniometer axis, stationary arm, and movable arm all have the same alignment. So I'm going to place the axis on the ulnar styloid process, the stationary arm along the shaft of the ulna, and the movable arm in line with the fifth metacarpal. This time I'm going to move my patient into extension while stabilizing the distal forearm. And I see that my patient has exactly 70 degrees of extension. This is normal. Her end feel is also firm, which is normal. It's either firm or hard. So now we're going to get into manual muscle testing. The first muscle that we'll be looking at today is the extensor carpi ulnaris. So this muscle does extension of the wrist and ulnar deviation. Now I'm going to ask you to hold this position, and I'm going to stabilize distal forearm while pulling the wrist into flexion and radial deviation. So don't let me move you. Hold, 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 hold. Good. So I would rate my patient at a 5 out of 5 because she could hold against gravity, and I used a strong force against her wrist and she held that position. Now we're going to do flexor carpi ulnaris. So I'm going to have her same positioning with the elbow flex. This time the forearm is going to be supinated and hand still over the table. Okay, so flexor carpi ulnaris does flexion of the wrist and ulnar deviation. So I'm going to stabilize distal forearm. Can you hold that there? And now I'm going to pull her into flexion and radial deviation. So don't let me move you. Hold, 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 hold. Good. I would rate my patient again at a 5 out of 5 because she was against gravity and resisted strong pressure. Lastly, I will demonstrate muscle length tests of the wrist flexors. So you want your patient lying in a supine position, and you want to stabilize under their distal humerus. With the elbow extended, you want to extend the digits and extend the wrist. At this point, you would measure the amount of range of motion in their wrist extension, and if this value was less than their normal value measuring in passive, that would indicate that the wrist flexors were shortened. That's all.